Hello, welcome to everyone. It's amazing to see you all. I think this is a record for one of our talks, so obviously really pleased to see you all. Just a quick thank you to all the staff here who make these talks so much easier for me as one of the organisers. I don't have to worry about all the teas and coffees. The lovely ladies look after that for me. There's an IT person, Richard, at the back, does all the AV and everything, so I can just turn up and not worry. I just want to do a sort of 2-minute quick update on University Hospitals Dorset. It's exciting times at the moment. As most of you probably know, Christchurch Hospital over the past few years has been rebuilt, so that's a new hospital. Poole Hospital, for those who have been there, we've opened last year a brand new state-of-the-art theatre block, which is being used now by our speaker, and he'll probably talk a bit more about that. And Poole Hospital is now, or will be, when all the changes are done, will be the largest planned care hospital in the whole of the UK. It will be an amazing facility. It will still look after emergency work in the urgent treatment centre there. So most people who make their own way to Poole Hospital for an emergency will still use Poole Hospital. The blue light work, so the real emergency work, when all the changes happen next year, that all moves to Bournemouth. Bournemouth, as you've noticed, I'm sure, has a huge new building, which is on time and on budget, which you'll know these days is very unusual. So this time next year, we will have moved the maternity unit in there. So the top two floors, as you look at the building, will be a maternity unit. Later next year is the major change, where it then handles all the emergency care for the whole of East Dorset. If you want to know any more, if you ever want anyone to speak to a group, just ask one of the governors here today, and we'll arrange a meeting, and we'd be happy to come and give you an update on the hospitals. As you can see, there's lots of changes taking place, and one of the things we're really keen to do is to basically keep you updated with all the changes. There will be changes, I think, for at least the next 5 years, if not more. So we run a completely free membership form. I expect a few of you have been told about it while you've been here. So we do have these membership forms. For those who are into their tech, we're trying to get up to date. We have a QR code. So if any of you just want to join, you can just come up to me and zap the QR code, which takes you straight into the membership part. So please have a word if you want to. We are now called University Hospitals Dorset. We've always had lots of links with the university, and all the hospitals, Bournemouth, Poole and Christchurch, are all involved with research, which has great outcomes for patients and for staff, because it gives staff lots of opportunity for extra training. And that leads me nicely into our speaker this afternoon, Professor Robert Middleton, who's an amazing example of the close work between Bournemouth University and the hospital. He's an outstanding surgeon, both known nationally and internationally, and he spends part of his time at the hospital doing all his amazing work, but he also runs a big research department at the university, so which is looking at ways to improve health overall. So it is with great pleasure I'm now going to hand over to the main person today, which is Professor Robert Middleton.
Right, well, thank you very much to Keith, first of all, for getting us all here. He's done a brilliant job, his team supporting him and the church. So I've been a consultant orthopaedic surgeon for 25 years at the Royal Bournemouth Hospital, and today Keith asked me to talk about how to avoid surgery, which, as it's my job and my livelihood from, I wasn't that impressed. So I'm going to tell you how to avoid surgery, but I'd appreciate you're not telling anyone outside this room. So, the first thing, the Orthopaedic Research Institute. I've been involved in research for about 35 years, initially in London at Imperial College, and then at the Royal Bournemouth Hospital, where I started doing research into hip replacements. And as you may know, Poole and Christchurch have the oldest population in the UK. Our population is approximately 10 years older than the national population. So the demographic problems that we have as we age, principally osteoarthritis, affect this area 10 years before they affect the rest of the country. So it's a very important area to do research and training in, because the research that we can do now, we can plan how we can best provide care for the rest of the country in 10 years' time. I set up the Orthopaedic Research Institute at Bournemouth University in 2015, and our mission was to prevent anyone suffering from the pain and disability of osteoarthritis. And we were going to do that by two means. The first is preventative, and that's what we're going to talk about today, because if you can prevent a condition, that's much better than treating it. But if we have to treat it, we want to have the best treatments available. So the Institute's involved in teaching. We have some superb teaching facilities, and we teach surgeons, doctors, nurses, physiotherapists, and other health professionals. We have our research labs there, and we've got teams of PhD students and young doctors looking at new treatments and new devices that we think will be advantageous, and also evaluating those to see if they have a positive outcome. In addition, we train surgeons, and we have a virtual reality lab. So we're trying to get away from practicing on patients. So doctors and surgeons come and work in our unit, and using virtual reality, they can practice doing the operations until they're safe to go into the hospital and do it. So a big improvement, not only for the doctors, but also for all of us who are patients. At the Orthopaedic Research Institute, we've got some of the latest equipment. Here we've got the Grail Gait Lab. There are only about 20 of these in the world, and they can analyse how you walk. We can simulate trips and falls, we can look at limps, we can look at different treatments to see if they improve function. The computers that run that gait lab, they run so hot we have to have a cooling plant in there to cool them down. But what they allow is instantaneous evaluation of the treatment. Normally, if you have a gait lab, you get lots and lots of data, and it takes a couple of PhD students sort of 8 weeks to get the answer. We can literally put a patient in, and within 10 minutes, we can have the data out. So we can turn around our research much more quickly. And then I said, at the other extreme, if we can't prevent arthritis, how do you treat it? So this is myself operating with a robot. So if you look at it, you can see myself, I'm holding the instruments, but this is the robot, and the robot also holds the instruments. So I perform every stage of the operation, but the robot prevents me from making a mistake. If I'm off by a millimetre or two, it will alert me, and if I'm more than a millimetre or two, it then nudges me back into the right position. And We've just completed the largest gait lab trial in the world looking at robotic surgery. The results are just coming through, but the initial indications is that it's more accurate, there's less tissue damage, and patients are recovering more quickly. But the most important thing is how we avoid surgery. So the aim of the talk today is to convince you that hip arthritis is preventable, that hip fracture is preventable, strong bones and strong muscles around the hip are the key, and hip strength also affects how long you're going to live and how long you're going to live independently. And that's probably the key thing of my talk, is that if you want to live independently in your own home, self-caring, the key thing is how strong your hips are. So arthritis, is it going to affect us? Unfortunately, the answer is yes. If you're over 45, 10% or 1 in 10 people will have arthritis. If you're over 75, 50%. So you've got a 1 in 2 chance. And if you're a woman, 60%. So there's a very high chance that most of us in this room will develop arthritis. So what are the NICE guidelines? NICE is the National Institute of Clinical Excellence, and it sets the standards for care within the NHS. And about 10 years ago, I was invited to sit on the panel with the great and good in the NHS, and we spent 2 years looking at all the literature and research in the world to find out what the best treatment for osteoarthritis was. And I was the surgical representative, and I was expecting it was going to be hip replacement, hip replacement, hip replacement. But unfortunately, that came down very low on the list. And the 3 things that NICE said would make the biggest difference to everyone with arthritis in the country was education, exercise, and weight loss. The problem was that when I returned to my clinic at Bournemouth, the only thing I had to help people was a hip replacement. You either got nothing or a hip replacement. And it was all very well saying education, exercise, and weight loss are the key treatments, but we didn't have anything in the UK or internationally to actually deliver them. And so that sparked the idea as, how do we devise a course that could deliver those ideals to prevent people getting arthritis, to treat early and moderate arthritis, to prevent people requiring a hip replacement. And I came up with a program called CHAIN, which stands for Cycling Against Hip Pain. So why did I choose cycling? Well, it was through personal experience. In my 20s and 30s, I had always run. I ran with a neighbour. We had dogs, and we used to run round sandbanks with the dogs at first thing in the morning, and we did it for many years. And then as I was coming up to 40, I thought, well, I better do a marathon before I'm 40. I'd done half marathons and 10K, but I'd never done a marathon, so I thought I'd do a marathon, and I did the New Forest Marathon. And for the first 17 miles, all went well. I was doing 7-minute miles. I thought, this is easy. I can just coast in. And then about mile 17, I started getting sort of low back pain. And then I started getting pain in my buttock. And then I started getting pain in my groin. And then the pain was going down my thigh to my knee and below. And each step I took, that pain was getting worse and worse. I completed it, but I was hobbling at the end. But for the next couple of weeks, my hip remained really painful, to the extent I thought, God, I'm going to need a hip replacement. And I didn't want that. So I couldn't run or hardly walk at that time. So my friend said, well, let's take the dogs out on a bike and we'll just cycle along the front. So we started cycling on the front. And I don't know, over about 6 or 7 weeks, the pain started to get better and gradually resolved. And we quite enjoyed cycling along with the dogs, so we carried on doing it. And then a strange thing happened. I went on holiday with the family, and we weren't cycling. But during that 2 weeks of holiday, I started getting that pain in my lower back, in my buttock, in my groin, and my thigh to my knee. I started limping again. I started taking the lift rather than the stairs. And I thought, oh no, it's coming back. And then I got home, we started cycling with the dogs, and it eased off. And that gave me the idea that maybe cycling was something that you could treat arthritis with, prevent it. So at the Orthopaedic Research Institute, we looked at all the literature, and what we found was that there was evidence that cycling could help. If you could build up and strengthen the muscles around the hip, it helped support the hip, so it pulled the hip apart so it wasn't rubbing bone on bone. It improved the blood supply, it improved the lubrication, and it also down-regulated the pain receptors. So we came up with chain, and so patients that came to see me in the clinic at the Royal Bournemouth Hospital, they'd been referred by their GP for a hip replacement. If they had mild to moderate arthritis, I said, would you like to try the chain program to see if you can control your symptoms and avoid a hip replacement? And we started a study, and it was a 6-week course. So we ran it in conjunction with Bournemouth and Christchurch councils, with the Littledown Centre, with the university and with the Royal Bournemouth Hospital. And we had a 6-week programme. It was an hour a week in the evening at the Littledown for 6 weeks, and half of it was education. We taught everyone who came along about arthritis and what they can do, and half of it was a spin class. So we had a gym instructor, and they took them through a spin class. And the majority of the people who came hadn't cycled since they were children, but over 6 weeks we took them through the basics, getting on a bike, getting your hip moving, right up to doing a full class by the end. And then we analysed the results, and they were quite incredible. Essentially, 83% of people had an improvement in stiffness, had an improvement in pain, and had an improvement in their quality of their life. So we had good evidence that if you did 6 weeks of cycling, that you could significantly improve your symptoms. The question then arose, was it a flash in the pan? Is it just going to last a few weeks or a few months? Because if it does, it's interesting, but it's not going to make a big difference. So we then did another study 5 years down the line, and we followed up the patients. And the key thing is, of patients 5 years previously that had been referred by their GP for a hip replacement, 60% had had no surgery. They'd avoided a hip replacement. 45% had not even been back to their GP about their hip. 96% said their hip was as good as it, was as good or better than it was 5 years ago. So that's a dramatic thing, a 60% chance of avoiding surgery. The gold standard in research is a randomized controlled trial. They're very difficult to do, they're extremely expensive, they take a lot of organising, but they are the gold standard, whether a treatment works or not. And so we got funding about £300,000 from the government through the NHR, and then we partnered with Bournemouth University, UHD, University of Exeter, BH Live, to run the biggest trial that's ever been done. And we compared people with arthritis of the hip having physiotherapy against the chain course. And that has just finished, and the data's coming through now. What it shows is conclusively that physiotherapy is a benefit. Okay? So if you've got arthritis of the hip and you see a physiotherapist, you can get a good improvement. But if you did chain instead, you got twice the improvement that you got with physiotherapy. So physiotherapy is good, but chain is twice as good. But it didn't stop there. So you say, well, we've shown that we can improve the pain and disability of having arthritis for early to moderate arthritis, and that for at least 5 years it can put off surgery for about 60% of people. But I don't think that's the most important thing. What effect did it have on people's lives? And so what I want to talk about now is lifespan and health span. So lifespan is quite simple. It's how long you're going to live. But health span's probably more important because it's how long you're going to live a healthy life, free from disabling disease, independent in your own home, because that's what we all want. So ideally, you want your health span to be as long as your lifespan. So you want to live independently in your own house and then fall off the edge, rather than having to have full-time carers or go into a nursing home. So does chain affect those? Well, the first thing is, can I predict how long any one of you is going to live, and can we do anything about it? And the answer is a resounding yes. Recent research shows that if any one of you came to my lab at Ori, I could predict very accurately how long you're going to live. Okay. So how can one do that? You do it by measuring a thing called VO2 max. Okay? So I can measure your VO2 max, and that will determine your lifespan, okay? Barring accidents and things, but it'll tell you how long you're going to live within a year or two. It's very, very accurate. It also determines your health span. I can tell you how long you're going to have a healthy, independent life. Okay? When you will get to that point where you can't manage on your own. So what is VO2 max? So it's simply a measure of how much oxygen your body can take out per kilogram of your body weight. It's a simple measure. There are two key things to understand, is that once you get into your 50s or so, it reduces each year with age. And you can't stop that reduction, but you can slow that rate of reduction, and that determines how long you're going to live and how long you're going to live healthily. What's the problem? Well, to measure it is hard, okay? You have to come into a lab, you have to go onto a cycling machine, and you have, for 20 minutes, you have to empty yourself out. You've got to push till you're exhausted and collapse, which is really hard to do. You have to be wired up to cardiac monitors and things. You need a resuscitation team around. And you need to have a mask on, measuring the oxygen you breathe in and the carbon dioxide you breathe out. So imagine that, sitting on the bike with a mask on, beasting yourself till you can't breathe. It's very difficult to do, very few people can do it, it's hugely expensive. Until last week, because this is what we're doing in Ori at the moment, we're doing research into a new device. All you have to do is you take your shirt off, you stick a sensor onto your chest, you do no exercise, and you lie still for 45 seconds. And then within 3 minutes, we've got a very accurate measure of your VO2 max. Do you want to see my result? Okay, I had a VO2 max of 51. That is exceptional for my age. Okay, about 1%, 2% will have a VO2 max of that level. And that is because I've been doing the chain for 20 years. It predicts my lifespan at 95 years. Okay, and in fact, my mother is 94. She's healthy and living independently still, so it seems to be reasonable. But the key thing is that VO2 max reduces by 1 per year. The next key thing is that you need a VO2 max of 23 to be independent. To go up and down stairs without falling, you need a VO2 max of 23. To walk around your house without falling, you need a VO2 max of 23. To get out of a chair, you need a VO2 max of 23. If you can't do those things, you can't be independent. You can't go shopping, you can't socialise. When your VO2 max is less than 23, you need live-in carers or you need to live in a nursing home. Okay? It's as simple as that. So if your VO2 max is 30, in 7 years, you're not going to be able to live independently. So it's all looking brilliant for me. Exceptional VO2 max, lifespan of 95, but if you take 51 and minus 23, I've got 28 years of health span. Sounds good, but at 88, I could have 7 years in a nursing home. So why is that when I've been doing the chain program for 20 years? It's because you need to do something else to get your health span as long as your lifespan. So how do you improve your VO2 max? The easiest way is through weight loss. So if you're overweight and you lose weight, you're taking in the same oxygen, but your weight is less, so your VO2 max goes up. Okay? Roughly, for people in this room, for every kilo you lose, you can add a year to your lifespan in your health span. I'm not overweight. I weigh the same as I did when I was in my 20s. But if you body scan me, which I've done, in my 20s I had more muscle, and now I've got more fat and less muscle. So I may weigh exactly the same, but the proportion of my body has switched. And that's inevitable. Like VO2 max, muscle mass gradually starts to decline. You can't stop it, but you can slow the decline. And certainly doing the chain program, so cycling, swimming, yoga, Pilates, walking 10,000 steps, all those things will slow the decline. They will increase your VO2 max because they increase the amount of oxygen you can take in. Your heart's bigger and stronger. Your blood system's better at absorbing oxygen. So your lifespan is going to increase. Your health span will continue to increase, but your muscle mass is decreasing. So the key muscles are your hip muscles. To get out of a chair, it's your hip muscles. To go up and down stairs, it's your hip muscles. To walk around the room, it's hip muscles. So to be independent, you need strong hip muscles. So exercise is essential, but if you want to narrow that gap between health span and lifespan, you have to do strength training. And it was only in the last few years that we realized that was the case, and I've started strength training, and that's improving. And my goal over the next few years is to try and get my health span out to my lifespan. So, strength training, at its simplest form, is doing squats. In its ideal form, is doing some weight training. Okay. Doing 20,000 steps is not enough. If you want to have that health span, you've got to do some strength training. And in addition, you need to look at protein and vitamin D. I suspect nearly everyone in here is not eating enough protein. Okay? When you're of retirement age, your protein requirements are double what they are as an adult, because your protein is breaking down. And so to maintain your muscles, you need to keep building it up. And if you're doing exercise and strength training, if you want to get your muscles bigger, you've got to eat more protein. And it's the key thing. If you do a weight training session, you recover afterwards, but you're building new muscle. And it's very common as we get older, is not only do we double our protein intake, but we often sometimes reduce it. So if you look at every elderly people, often their muscles are quite wasted, and that's why they can't get out of a chair. It also affects your risk of hip fracture. Okay? As I said, if your VO2 max is less than 23, you can't get out of a chair, you tend to fall on stairs, you fall in the house. The trauma is minimal, but you end up having a hip fracture. And that's because, do you know what bones are made of? Protein. They're protein, 80%, with calcium in. And how do you get the calcium in? Is through vitamin D. So if you're not got enough protein in your diet, and you haven't got enough vitamin D in your diet, you're not going to have strong, healthy bones. Your VO2 max is less than 23, you're going to fall and break your hip. Did you know that the only supplement the government recommends is vitamin D? Okay. The government recommends that every adult should be on vitamin D from October to April every year. And the reason is, to synthesize vitamin D in your skin is where we get it. You need 30 minutes of sun exposure a day. We struggle to get that in the summer, let alone the winter. So just to repeat, the government recommends every adult should have vitamin D from October to April. So hopefully you see, if you want to prevent breaking a hip, doing something like chain exercise, doing some muscle strengthening, making sure you've got more protein and taking vitamin D, you've got a very good chance of avoiding it. So what are my recommendations? Well, when you go home, if you, on the computer, Google NHS BMI calculator, you put in your age, your weight and your height, and it will tell you what your BMI is. And it will tell you whether you're underweight or overweight. You may be underweight, and so you need to increase your food intake, particularly protein and carbohydrate. And if you're overweight, it'll tell you what the maximum healthy weight for your height is. And if you're 7 kilos over, if you lose 7 kilos, you're going to put 7 years on your life. Diet is important, but probably not going on a diet. Diets can be useful for rapid weight loss, but unless you change your lifestyle, they don't tend to make a long-term difference. The key thing is about the quality and quantity of the food that you eat. In our diets, most of our food is ultra-high processed foods. The commonest one is supermarket bread. Okay? An ultra highly processed food is anything that's wrapped in plastic with a list of ingredients that you don't have in your kitchen. Okay? That's what it is. It's extremely bad for you. Anything labelled low fat is extremely bad for you because it's full of industrial chemicals and carbohydrates. So it's the complete opposite that we've done all our lives. My father's a doctor, we always had low fat everything, but it's bad. The trouble with ultra processed food is that you absorb all the calories very quickly, so you get the peak in glucose and insulin, so you're more likely to get diabetes. You feel hungry very quickly, so you eat more and more. And all the evidence is that you need to move to raw, unprocessed foods, so fruit, vegetables, pulses, legumes, dairy, eggs, chicken, fish, lean meat. If you prepare the food yourself, you'll not only have a healthy lifestyle, but you're likely to lose weight as well. So counting calories works to a degree, but a good example is almonds. If you've got whole almonds and ground almonds, they've got the same number of calories, but if you eat whole almonds, you only absorb half the calories. And it occurs on a very slow basis, so you feel fuller for longer. If you want sort of advice, there's a Zoe podcast, if you listen to podcasts, run by a professor of sort of nutrition at Tommy's, and it gives very good, general advice. I must admit, I find it quite addictive, and I listen to it each week. You can sign up, and they have an app and everything, but their podcast is entirely free, and I think that's probably the best advice there is. In terms of exercise, you need to average about 30 to 60 minutes a day, and that can be walking, cycling, swimming, yoga, Pilates, tennis, golf, whatever you enjoy doing. Sleep and recovery is important as well. So we're doing the exercise, and essentially when we're doing the exercise, we damage our muscles. Okay? And then during sleep and recovery, the body builds them up again. And that's why getting your nutrition is important, because during that recovery phase, you want all the nutrients to be there. It's a bit like a plant. A plant needs sunshine, but if you don't water it and you don't feed it, it's going to be a pretty sickly plant. And that's the same with your muscles. It needs the exercise, but it needs the rest and recovery and the nutrients to grow strong. So you want to aim for about 7 to 9 hours a day. If you have a heavy session in the gym or a very long walk, then you may need to take it easy the next day or the day after. Let your body recover. So muscle strengthening. So that's the change that I've made in my life, is that I now do muscle strengthening. Okay? You need to do it at least once a week. If you can do it 2 or 3 times a week, that's brilliant, but once a week is enough. Things like squats, light weights, going to the gym. But it's an essential part. If you want your health span to be as long as your lifespan, you've got to do some muscle training. And as I said, increase your protein intake and take a vitamin D supplement from October to April. I'm going to give you something free now. So we talked about chain, and chain, you had to be referred to the hospital, and then we sent you from that, and there are obviously limited numbers that can benefit from it. Today, we've just launched our app, which is entirely free. So if you've got a smartphone, if you go to the Apple or Google App Store and type in Ori Education, you can install the app. There's an introduction, you have to consent to doing the course, and then you can access chain. So it's the same course that we've done that's been proven to stop you having your hip replaced in about 60% of people at 5 years, and you can do it online. I would encourage you to do it even if you haven't got arthritis, because one, you've got a good chance of preventing it, but two, if you want to increase your lifespan and your health span, then that's the easiest way to do it. So I'm going to end there. Thank you very much for listening to me, and I hope you found the information useful, but education, exercise and weight loss are the key things to a happy life. Thank you.